That's awesome. So welcome, welcome, welcome. Today, I want to introduce you to our guest, Beth Weinberger, who's the Director of Research and Policy at the Southwest Pennsylvania Environmental Health Project. So I was really excited to connect with Beth and learn about the health impact assessments. So Beth has a master's degree in public health and a PhD in political science, and has been with the organization since it first opened in 2012, and is particularly interested in children's health and environmental justice. So welcome, Beth. Thank you so much for coming on. We're really excited to learn from you today and learn a bit more about the impact assessments and how we can use them.
Great. Okay, so I guess you have the quick version, the quick view of who I am. The Environmental Health Project is an organization focused on the public health consequences of shale gas development, shale gas and oil development. And now, sort of following the industry, we've been working more also in communities with the petrochemical build out. Our primary office is in Southwest PA, but we've worked in other states in the region, Ohio and West Virginia. And then beyond that, we've had a long-term study in New York State and worked with some communities there. We've worked at communities in New Mexico, New Jersey, and somewhat all over the place. Oh, my slides are not advancing. Okay, so we've designed what would be termed a rapid health impact assessment. It's a way for communities or advocates or public officials to pull together data and information to provide an argument as to whether it's safe to build a particular site in a particular location. And over the years, we've figured out what communities are generally concerned about, what types of information would be needed to characterize the problem, and what types of questions should be addressed. We've developed different templates. So we have one that you might use for well pad, one you would use if you're worried about a compressor station, one for injection well, one specific to truck traffic, and one specific to the risks involved if a site is going up near a school. There's no doubt that the permitting, siting, operating, and monitoring of these sites is heavily weighted in favor of the oil and gas companies. But we know that communities want to be able to make their case to regulators and decision makers about the risks being imposed on them. And so we work to come up with a way to support communities in doing that. And the HIAs are our way to sort of help bring local data and information to the table. On the HIAs, there's different sections. So there's a section about the site in question. There's a section for concerns of residents, information about the immediate area, information about polluters that might already be in the area that would be compounded by a new site, information on community health, and information on expected emissions from a site or expected disruptions, and then a section on health risks. It's important to say, I feel like it's always important to say that while the industry and even government officials will often say we just don't know enough about whether there's health effects near shale development sites, I would like to say that's not the case. There's really no mystery anymore. There's a lot of research on the health impacts associated with living near shale oil and gas sites. We've been gathering data for 8 years now on the ground. We see evidence of it, researchers see evidence of it. So I just would like to sort of dispel the theory that we still don't quite know enough. So there's 5 reasons why we think health impact assessments would benefit shale communities. 1, communities can benefit from an organizing structure to evaluate local shale development. 2, health impacts have been documented near UOGD sites. 3, all parts of the shale gas infrastructure are known to produce emissions. 4, water and air contamination have been documented, and 5, consequences of shale are local, and local governments have a responsibility to protect health and safety within their boundaries. And we focus on the local because we think that's actually where communities or advocacy groups can have the most impact. So the report that comes out of a health impact assessment is designed to give residents, local decision makers, and state public officials a checklist of questions that ought to be answered before a site or potential site can be deemed safe. And it's a structured way to bring together data on your community, the expected emissions from shale gas development, and the potential health risks posed to adults and children in the immediate area. We like to see it as a proactive tool where communities or individuals or even local officials would kind of put in the time beforehand and get a sense of what the risks are, if any, of a site going in. EHP has found that communities are wrestling with some pretty significant concerns, and those concerns are what sort of drove our design of the health impact assessment. So there's existing conditions in the community, other polluters, thinking about communities that are vulnerable, maybe environmental justice communities or communities where there's young people living close to a site. People are concerned about whether they have complete information. Spoiler alert, they don't usually. Concerns about what health conditions might or might not be produced. People with concerns about whether they can feel confident about regulations that are in place or public officials protecting them. And maybe you all in your communities have additional concerns, I'm sure you do, but those are ones we see quite a bit. And we realized that it was hard to get from all those concerns into maybe a report with some weight in it, with some numbers in it, with some science in it. And so we thought that by communities getting sort of local data and emissions data and exposures into the center of discussion. So we thought this kind of information could then be presented maybe at a state meeting, maybe in a hearing, when reviewing or revising local ordinances, holding a press conference. I mean, once it's gathered together, you can use it in all sorts of ways. The HIA revolves around one central question, which is, do you have enough information to determine whether it is safe to have, for example, a shale gas compressor station in your community? And often a company applying for a permit has provided its own data and analysis and shows that its emissions will be at an acceptable level. And many local boards and other governing bodies and community members will take that at face value because it's what you got, is what they give you. But our feeling is if you're going to have a chance of ruling against development or creating ordinances to slow or block it, someone has to challenge the company's statements and prove to decision makers that it in fact poses risks, or that the company hasn't actually shown that the site is safe. So we've tried to create this relatively easy to use template that allows you to provide that data and that information as kind of a counterweight to what you're going to get from the industry. The 4 main features of the HIA are what will be on the site, who will be near the site, near enough to be affected by it, what are the emissions that might be released, and what are the potential health effects. Community members and local boards and maybe state officials have said they don't even know all the questions to ask. We've heard that both from public officials and community members. So at the beginning of the HIA, we've provided the questions we think are the important ones to be considered, and we put them in a checklist. The 3 reasons we did this is because it very easily lets communities know how much or how little they know about this site. It allows them to give maybe your zoning board or some other supervisory board a checklist and say, here are the central critical questions that need to be answered. And in doing that, it kind of puts them on notice. So here's a portion of it. Here's some other questions that are on our checklist. We have the not provided, incompletely addressed, and addressed well. It documents what you do and don't have enough concrete information about. It will raise awareness of the decision makers by spelling out what he or she should be addressing. It provides a vehicle for saying you have not considered these factors. You know, maybe there's 6 of them in the full list. Once officials and decision makers have been given the checklist, they really can no longer say they never thought about whether exposure to compressor stations can pose a risk to pregnancy or prenatal development, because you've already provided them with this this question on paper with 3 checkboxes next to it. So it turns a I didn't know to ask about that into sort of I opted not to do my homework and figure that out. We've actually had worked with some communities where they've just used the checklist. They looked at that and they thought, this is what I need. This is what I need to hand to everybody on whichever board, just so we can all discuss these, you know, this 1 page of questions. And then here's some of the questions on the health impact assessment itself. So it allows you to say everything you know about the compressor station, maybe if it's an existing one or if it's one that's being proposed. And it's often good to point out that a compressor is not just a compressor, and maybe there's dehydrators on site, maybe there's condensate tanks, maybe there's some other waste container on the site. And so it allows you to flesh out what exactly you're talking about when you're talking about a compressor station. And the same goes for any of the other kind of sites. This is another question in the HIA. What is in the immediate area? We divided it into half mile, 1 mile, 2 miles. And again, that allows you to be very specific about what the potential effects might be on these different groups, or different resources like agricultural, water reservoir. I've had people talk about ball fields, you know, other recreational areas, playgrounds. So, so that just allows you to be very specific. About the site itself or the facility itself. This is where you would put expected emissions. We also provide a fair amount of information within the HIA. So we can provide information as to if you don't have information about a compressor station and that's what's going in and that's what you're concerned about. EHP can often provide what a typical compressor station will emit, what a typical compressor station or a compressor station of that basic size, you know, what that's going to emit, what's a blowdown like for a place like that. So it's a combination of anything that on your side you can provide, and then EHP can do its best to support that by providing information that we have. And then at the, well, then there's some questions, I don't have them here, but about the sort of underlying health of the community. And for that, you might go to American Lung Association, you might have school data, but it allows you to put in some information of what the health condition is of the community at this moment in time. And so maybe that's before something goes in. or maybe something's in and being expanded, or something new is coming in. But it allows you to kind of set the stage of, here's the community right now. And we provide some guidance and information about how to talk about that. At the end of the document, we provide information, and it's all pretty short, pretty easy to digest, something that the decision maker could kind of flip through fairly easily. And so at the end, we document information on the different chemicals that you're likely to see. We talk about particular vulnerability of children, and that stuff you can even just cut and paste into some other section if you want it there. We also have at the end recommendations for if a facility gets cited or already is cited, what, for instance, a municipal government or the state might require to minimize the risk and to mask transparency. And in terms of how it can be used, communities have used them in different ways. If it's sort of starting at the community level, it's kind of a nice thing to be able to hand off if you have another organization who are maybe going to come in and support your efforts. It allows you to present a whole lot of information in a kind of compressed way, and it allows you to kind of have a picture of what are the missing pieces. What do you wish you still knew? So, if you were working for sort of a legal organization, you could hand it off. If you were working with some other advocacy group, you could hand it off. We also think that community groups and advocacy groups themselves could undertake a health impact assessment. It doesn't have to just be community members, but if you're working with a group, an established advocacy group, then that group might be able to pitch in and pull together the HIA information. One of the things that we know people have done is with their completed HIA is at a hearing, they knew there was only a limited number of people that were going to be able to talk, and they didn't want for their sort of the people that their grassroots group, they didn't want them to reiterate the same points over and over because there's limited opportunities. And so they actually divided up sections of the HIA and pulled out points so that one person could talk about what was known about the emissions, and another person could speak to the issue of school and can you actually transport all children from a school at the same time. And another group could have talked about all the other polluters in the area. And so you can't just think about this one well pad when it's actually the fourth well pad. But sort of actually, we didn't realize anyone was going to use it that way, but that was, they found that really effective. It's the kind of thing you could draw on for if you do any formal written comments. I know I talked to someone who thought pulling together the HIA itself served as an organizing tool. She was wanting to kind of bring people together, and the process of doing the health impact assessment among those residents kind of pulled them together. And I thought that was really interesting. We've talked to people who've provided it to their lawyer. Not so much that any of this would be on its own admissible anywhere, but again, it just provides a lot of background information all at once. It can be used to educate, and especially that checklist can be used to hold officials responsible. And that is my short and sweet discussion of health impact assessments. We do have a bunch of them. They're available on our website. You can do it all on your own, or you can enlist our help. You can tailor it to suit your own needs. You can emphasize certain points. So it's really a tool or a set of tools meant to be out there being used either with us or without us. And that's it, but I'm really happy to talk about other people's experiences of trying to make their case and their sense of whether the more data would have helped, or I'm happy to answer questions, but I would also love to learn about what communities are doing to try to bring information to the table.
Thank you so much, Beth, for the presentation. And we have a few questions already in the chat that we can look at. And then we can also, I think it would be great to to show on your website where the different types of templates are
Okay.
as well. That would be really cool to see. So I'm happy to pull that up after we get started
Okay.
with the first question. There's a technical question. Will the presentation be available, like the PowerPoint or the PDF?
Yes. So this whole thing is recorded, right? So this is,
Yeah.
but also if someone just wanted sort of the slide presentation, yeah, I can make that available. So
Cool. Thanks so much.
we can put that on the EHP site.
Awesome. Yeah, it's a question from Ashwani. Thank you. And let's see. So we have Anita says we need resources and contact information on contamination drilled well water, wells, and soil and air contamination. So I don't know, Anita, if you want to clarify that into a question, let me know in the chat. And we'll go to, and then there's also Weston says, you know, what about the effects of benzene? You know, is that something that can be added to the checklist?
Yeah, I mean, for the checklist itself, we kept it somewhat broad so that it was achievable, but we do, and you'll see if you can get to our site and look at some of the actual templates, that there's more questions than I put up there.
Okay.
But it's more, for instance, you know, have you looked at the effect of VOCs? Have you, you know, looked at the potential effect of radioactive material coming up? So,
Great.
but once it's in your hands, you can really add anything and emphasize anything, because there's areas on the form itself where you can just say, here's our community concerns, and then you can really just write that out so that you get it on paper and get it in your own words and the way, you know, you want it to read.
Great. So I see well pad template.
Yeah, so you could
compressor
pull that up
station,
if you wanted.
petrochemical complex template. And what's the difference between a template and a checklist?
So the checklist is just that, I think it's down to one page where it's, do you have enough information? Yeah, so the third page, I think, on this is going to be the checklist. Yeah.
Oh, okay. So the checklist is inside the template, but
Yeah,
it's also
so
a
it can
separate
be,
document.
yeah, or you can just use that. If all you want is to hand your zoning board something that says, here are all the things that we need to know before you go forward.
Nice.
So I know some communities, that's all they want. And some communities really want to amass all the concrete information in one place.
Yeah. So like if you kind of go through this document, you have the checklist, which can be a way to really, I mean, this is like really holding the decision makers accountable too, right?
Yes.
You're like,
Absolutely.
hey, this is what you're making a decision about. In fact, it's not one thing, it's like 20 things, and they're all things that require research, and you have to prove that it's safe. So you're really putting them
right. So for instance, what have you given us your plan for wastewater, or have you shown us that you have a comprehensive plan for wastewater? And then you check not addressed, incompletely addressed, or ideally addressed to satisfaction.
Wow. Yeah. Thank you. And so then if you kind of go through this document, each of these is like a worksheet to really gather all that information. I'm going to go back to the chat. Feel free to say anything else about the template if you want while I pull up another question. And Yeah, it's helpful if I'm going to put this in the slide next time. It's really helpful to see the cue at the beginning of the question, because when I look through, I'm like having a hard time seeing it in a hurry. But great. Um, so Elizabeth, hello, Elizabeth in Texas. Is there a component that interprets this public health information with financial costs to public sources like city, county, or state? Frankly, public health often is not a priority for most of these officials and most citizens. Their primary social and civic value is money. Perhaps what is needed is a business ethic or a social responsibility component.
That would be awesome. That's beyond our scope, but it would be great to have as part of this health impact assessment, the effect that this development is likely to have on the economy, short term, long term,
Mm.
property values. So I think that would be great. And again, what we have could be used on its own, and then a community could come up with a second set of questions or a second set of issues. There's a little bit of research on that right now, I think out of Carnegie Mellon, on sort of the costs. There's a little bit more and more research on the costs of the health burden that communities are undertaking, the costs of every, emergency room visit for asthma that's likely was triggered by these emissions. So, I mean, it's a great, in my dream world, I would love to do that. So I don't know, stay tuned. Maybe we'll get to it, but.
Well, and Elizabeth, maybe you know somebody that would work with you on this, or maybe this is something you could do, because this is such a great, I mean, what I love about templates is that this is really an example. I mean, you could really take this model and say, okay, we're going to start with a checklist. We're going to think of all the things that we want the decision makers to provide, an adequate answer to. They need to address these issues. And then you can do research or find somebody who's a researcher to really dig into some of these issues and just turn it all into an economic one. So you can have the health impact assessment and an economic impact assessment. And if you do that, if you're watching this and you want to take on a project like this, we should have a webinar about it. Fantastic.
Sounds like I just got myself a job. Thank you.
All right. Yeah. Okay. So Anita says, will this also be about the health risks about drilling being close to a residence and the health issues of those residents?
Yes, that will absolutely be addressed, because we talk about how close residents actually are to a site. And then if you know what's being emitted, you can have a pretty good sense of how those residents might be affected.
Mm-hmm. Great. We have a question from Peter. Thanks, Peter. I recently traveled through northeastern and central PA and realized the shale is found in many gradients of natural fracture, large massive pieces to small chips. How does this variability play into the analysis of a drill pad site?
Well, I mean, in our community work, so not our HIA work, but when we work in communities, we do a really in-depth assessment of that area. So, in that case, we're looking at not just emissions, but weather impacts, geography impacts, and, again, figuring out what the emissions are surrounding a particular property, or mostly we're doing it as community-wide. So in that work, we do a really comprehensive look. For the HIA, I mean, ideally, if you have information about a particular site or area that you're looking at, that can make its way into the HIA. So, again, if it's a enormous well pad, but with really not a lot of residences or businesses around it, you might sort of word things differently than if it's a site smack dab in the middle of a neighborhood. So, but it whichever it is, there's room for you to explain that. And there's room to think about how dangerous that might be for a person living near there.
Elizabeth has another question. Is this being adapted to the current downturn in activity of the fracking industry?
I mean, we are thinking a lot about that. The questions are all the same. You know, whether the industry is on its way up or on its way down, the questions are the same. You know, have they paid attention to the current concerns of residents? You know, are they thinking about what types of chemicals are going to be emitted? You know, are they even thinking about sort of what part of the day most of the emissions might be emitted, because that makes a difference for health risk. So the questions are all the same. We do worry that as companies start to show some fractures financially, that's actually a more, or can be a more dangerous time, because they're cutting corners more. They may be kind of halfway on their way out. Things aren't monitored as well, if they were even monitored well to begin with. So, so we actually are not worrying less. In some ways, we worry a little more about those sites as companies start to fray at the edges.
Another question is, do these studies include waste disposal sites, liquid injection, and solid waste treatment?
We have one, oh, it's not up here on our site yet, for injection wells. We do not have other like waste sites, but it's on the list of things to do, so that there will be one that has to do with waste sites, because that's obviously a huge concern. We just didn't get to it yet.
Great. And so you'll adapt those, and then so for some, where can people get notified when that gets published?
I have a feeling that will go out. It'll be on our site, and it'll probably go out through our social media and our email list. We tend to post things as they come out.
Okay, great. And Sharon has a comment, says, just read EHP's, Environmental Health Project's, letter to the Pennsylvania Department of Health from August of 2019, and it's a knockout. Wonderful. With recent developments with Josh Shapiro's office, we may all be talking to you as our response to the grand jury report gets crafted.
So whoever you are, you should email me. Yeah. So much to say about that grand jury report.
So that comes from Sharon Furlong.
Oh.
Thanks, Sharon. Yeah, and Janet replied to say that Elizabeth's comment on the economic impact is important, just because of how much they focus on jobs and sort of promoting jobs, when that can be very easily dispelled with looking at how it actually plays out over time.
Right, and maybe compared with other types of jobs that might be as beneficial or more to a community.
Mm-hmm. Yeah. Joe has a question. Where would I get information on other polluters? My community has some sort of paper processing plant that frequently makes emissions that residents complain about. I'm not sure if air quality has ever been tested in the area, but I just list that as an area of concern due to a foul smell. The township is considering the first 2 well pads, so fracking isn't currently causing pollution in the area.
So I would definitely put down that there is this other major polluter with unknown pollutants being emitted as a concern. And so if a well pad goes in, it would seem to me that you would say it's not enough to think about what that well pad might emit, but it's going to be on top of this other facility, and we're going to get it from both sides. And you would want to encourage this decision maker, this set of decision makers, to look at both. In terms of for an individual who's concerned about a polluter that's not shale, I don't know that stuff off the top of my head, but you could email me and I could brainstorm.
Great. Thanks, Joe. Justin is asking, are you documenting health impacts of individuals and mapping them to locations so as to identify clusters in relation to known fracking infrastructure locations?
So we have worked with individuals, and now mostly we work by communities, and we do collect health information. One, it allows us to sort of put the picture together and tell the individual what we're seeing. We don't share health data of individuals in a community with the other communities that are involved in one of our citizen science projects, community science projects. But a lot of that is knowable now in terms of what the effects are at an individual household, what the exposures most likely are, and then we can't get all the way to proof that's going to hold up in court. But as public health scientists, we know that we'll find things that are perfectly plausible and don't have a lot of other explanations. And, to us, that's a reason to move, as a public health agency. And it allows us at the individual and sort of small community area level to provide some guidance about what people might do to reduce their exposure. So we do have a sort of both a community angle and within that an individual angle where we provide people with information back.
Mm-hmm. And is that the health registry or the health channel?
So yeah, actually the environmental health channel is a great place to look at sort of what people are saying about their own health. So people who've been interested in participating. Yeah, so you're pulling it up. It's nice. And in the HIA, health impact assessment, there is a place to put down among, the community's concerns, maybe that they feel like they have a high rate of asthma in their schools, or, they know X number of people who are complaining about this when there's an odor. So you can load all that stuff in. But yeah, this is our environmental health channel.
Mm-hmm.
And then within that, there's sort of people who tell their stories, which can be pretty effective.
Oh, like these
there's
stories.
the health symptoms. Yeah, you can map the health symptoms also.
Gotcha.
Yeah, it's a pretty nice resource.
And great. So that's environmental health, envhealthchannel.org. I'll put it in the chat as well so everybody can have the link to that. Great. So there's a few more questions here. Let me just go back up a little bit. Anita says, a proposed cracker plant is being considered in Belmont County, Ohio, in Dilly's Bottom. Local citizens are concerned about the pollution and health risks.
Yeah, I think so there's that and the Beaver County one. So we have a health impact assessment for those kind of plants. It's sort of just out of development. So we may still make some improvements on it, but it is available, including, so first the checklist and then a full template about the risks that may be posed to the community and sort of how do you quantify all of that.
So it's the petrochemical complex, isn't it?
Yep.
Yeah, Anita, I hope, feel free to respond to this if you want. Hopefully this is.
Yeah, that could be helpful. Download it and see if it's something you would want to invest some time in.
Yeah. And also just want to say thanks, John, who's posting some articles in the chat that kind of support things that are coming up in the conversation. Reducing air pollution saved the US $24 billion on elderly health benefits. The mortality and medical costs of air pollution, evidence from changes in wind direction. Yeah, a bunch of links here. So let's see. So a question. So Marcia also just says, hey, can you connect with me to Janet? So that's good. People are making connections here. And another article from John, thank you. A lot of articles from John. Okay, John, you're giving me a job. I'm going to go back through the chat and compile these articles. Thank you. Great. So, yeah, if anybody has any additional questions, please drop them in the chat. We see Philip says, in Denver, Colorado, we're putting together a proposal to evaluate the impact of a refinery, Suncor, on the surrounding community. And is wondering if Beth, if you'd be interested in helping out or helping to answer any questions for that project. The state has pledged $2.6 million for the effort. Our proposal will be weighted against others. Ours will be a community grassroots proposal. So are you saying, Philip, that the proposal is to evaluate the impact, and so the money would be to help you evaluate it? Or are you saying that the money is to help the refinery? So sounds like it's the first one, I'm hoping. Sharon has a question. There are reports out about the impact of pollution on recreational industries and businesses in Pennsylvania. And there are reports about how much money recreational, okay, so that's not a question, it's a comment, but thank you. How much, yeah, reports on how much the recreational activities could compare with the sort of projected, oftentimes lies, economic benefits of oil and gas. And Alice has a question. So I'm planning to attend Northeast Petrochemical Conference and trying to learn from them and also influence their thinking as industry insiders as far as the risk from aware public to their investments, like volleys across the bow to make them feel more at risk from us. Alice, feel free to clarify. I don't totally understand your question there, but nice to see you, Alice. It's been a while. So I have a question, Beth, which is because there's what do you like? What advice do you have? Just because it seems like there's interest in this model, right? Beyond just like you're in Southwest Pennsylvania, but clearly the people that are here are from a wider range. So there's an interest in really like adapting this approach to other states that might have different regulations, different processes, or even adapting this approach to an economic assessment, or adapting it to types of facilities that you haven't created a template for yet. So could you speak a little bit on like the flexibility of this and the role that Southwest Pennsylvania Environmental Health Project might be able to play in supporting people?
Yeah, I mean, we do work outside of Southwest PA, even way outside of Southwest PA. So that is not a problem. You know, we're like probably everybody here. We're on, you know, we have limited resources, but I would say it's always worth a call, because if there's a way for us to help on something like this, you know, if someone does want to develop a health impact assessment or some other document that will provide information on, you know, an oil refinery. I mean, it's possible that we can provide some guidance, even if it's not our area, or we'll, you know, just be able to say, we're so sorry, but, you know, here's 2 other people you might try. And so we don't have all the answers, but I would say as an organization, are filled with pretty good resources. And again, you know, depending on, you know, the funding, we're happy to work outside of our region. And we do often work outside of our region.
Awesome. Thank you. And I have a couple more questions that just came in. Justin says, could anyone who's connected to an environmental group put the name of their group in the chat? I'm working on connecting with more groups and helping groups connect with one another. Justin, I'm so glad you brought that up, and I'd love to see what comes up in the chat too. I would love to show everyone the project that Halt to Harm Network that me and folks at Halt to Harm have been working on. And some of you here are familiar with this because you were part of the sort of beginning of it when we started to imagine what it could be. This is a project called the Campaign Network. And it's an online social network that's dedicated to issues around the oil and gas industry, like opposing the oil and gas industry, protecting ourselves from oil and gas industry. So the way that it's being used is to have events and discussion groups and actual campaigns. So like using this space for mobilizing. So there's over 350 members in already, mostly in the like Pennsylvania, West Virginia, Ohio region. There are a whole bunch of different groups that are currently testing. There's a few that are very active, but there's a number of different groups that are testing the platform already. You might recognize some of them. The most active group at the moment is tackling the A to Z impacts of plastic. And this is an ongoing series. And in many ways it is focusing on the cracker plant and the petrochemical build out is one of the topics that's being brought up here. And so inside this space, and I can send a link for everybody to join if you're not already a member. What's really nice about it is that it's kind of like Facebook, but a little bit more specific and focused on our community and what we're working on as people who are trying to connect with each other, groups that are connecting with each other, and campaigns. And Halt to Harm Network has been, and the reason why Halt to Harm created this, and by the way, Halt to Harm will just be one of the groups in here on equal footing with everybody else. So we're really setting this up as a service. But Halt to Harm creates services and offers support. So one of the main services that we offer is campaign support. And it's kind of like support and consulting around planning and connecting with people and promotion for your campaign. So we kind of get involved as almost like as if you were like contracting us to work for you, but it's not, but you don't have to pay anything because it's just one of the services that we offer. So anyway, we're really excited about this. We're going to be launching big in September with an online conference. And so, yeah, definitely check it out. The URL for this is the Campaign Network, but I wanted to respond directly to Justin because you were asking about connecting with groups, and there's quite a few groups in here that you can connect with. So I'm going to put the link in the chat. Great. So let's see. There's another question here. Is anyone doing studies of areas targeted for LNG plants along coastal areas, like air quality, public health status before, during, and after development, and production, export operations?
Off the top of my head, I don't know. It could be that somebody else at EHP knows that. But if that person wants to send me an email, I can see if we know anything about that.
Cool.
Organizationally.
And like one of the reasons that we're so excited about the Campaign Network right now too is like that's the kind of question, Elizabeth, that you could post, and you can imagine like posting something like that on Facebook, and it's great because Facebook is where so much stuff is happening. And one thing that we might say is, one of the benefits of having a space that's not on Facebook but more specific is that it's like if doing outreach for your organization or your campaign on Facebook was like doing outreach at the state fair, and doing outreach or tabling for your campaign in the campaign network is like tabling at a summit or a conference that's focusing on oil and gas issues. So just the people that are there. Whereas on Facebook, we're usually sharing our content with, friends, family, neighbors, aunts, uncles, coworkers. So it changes the dynamic a little bit when it's more focused. So, and I could talk more about the campaign network later. I have an event about it next week, so I'll email about it. So it's just about time to wrap up. We got to all the questions. We're really excited that you came today. We had a great turnout. Thank you so much, everyone who posted a question or said hi in the chat. Please help spread the word. We're going to have the replay available for you as probably by tomorrow, we'll get it sent out. You can find all this information, including other webinars that we've done, including a few with EHP on helptoharm.net under the webinars tab. We have a full archive of past webinars available here, including some of the A to Z impacts of plastic events. So please check it out. And yes, and Ashwani, Beth is going to be able to provide the presentation as well for you. So thank you so much for bringing that up. All right, I'm going to stop sharing my screen. I will be following up with you with a replay, and I encourage and support everybody to create a profile in the network and connect with us there. It'll be really fun. Bye. Peter's clapping. Thanks, Peter.
Bye. Thank you.
And thanks, Beth. It was really great to connect with you. I look forward to doing more of these.
Thank you, folks. That was fabulous.